Lyme disease is a bacterial infection caused by Borrelia burgdorferi, transmitted through the bite of infected black-legged ticks, also known as deer ticks. It is most common in wooded and grassy areas where these ticks thrive. When a tick bites, the bacteria enter the bloodstream, spreading to joints, the nervous system, and even the heart if left untreated. The first symptom of Lyme disease is often a bullseye-shaped rash called erythema migrans, which appears within 3 to 30 days after a tick bite. Other early symptoms include fever, chills, muscle aches, headaches, fatigue, and swollen lymph nodes. If untreated, the infection can lead to joint pain, Lyme arthritis, nerve problems, facial paralysis, Bell's palsy, and heart complications, Lyme carditis, which can cause irregular heartbeats. Some people develop chronic neurological symptoms, such as memory problems and difficulty concentrating, known as post-treatment Lyme disease syndrome, PTLDS. Lyme disease is diagnosed based on symptoms, tick exposure, and blood tests that detect antibodies against the bacteria. However, early tests can sometimes give false negatives, so doctors often diagnose based on clinical signs. Antibiotics like doxycycline, amoxicillin, or cefuroxime are used to treat Lyme disease, and most people recover fully with early treatment. In later stages, antibiotics may be required for severe infections affecting the heart or nervous system. Prevention is the best defense against Lyme disease. If you spend time in forests, tall grass, or wooded areas, wear long sleeves, pants, and insect repellent containing DEET. After outdoor activities, always check for ticks, especially in hidden areas like behind the ears, under the arms, and along the hairline. If you find a tick, remove it carefully with tweezers, pulling it straight out without twisting. Ticks need to be attached for at least 24 to 48 hours to transmit Lyme disease, so quick removal greatly reduces the risk of infection. Lyme disease is most common in the northeastern, midwestern, and Pacific regions of the U.S., as well as parts of Europe and Asia. Due to climate change and deforestation, tick populations are spreading, increasing the risk in new areas. While Lyme disease can be debilitating if untreated, early diagnosis and antibiotics usually lead to a full recovery. Being aware of tick risks, using proper prevention methods, and seeking medical care if symptoms appear can help protect against Lyme disease.